Welcome back to Move Up Health and Fitness and the University of Pacific's Young Onset Parkinson's Disease series. As always, my name is Anthony Servania and I'm an OTD student from the University of the Pacific. In this video, I'll be talking about balance training and the benefits of performing balance training towards the management of YOPD symptoms. Before we begin, I'd like to go over the disclaimer and safety notice. The following video is intended for general wellness and educational purposes only. It is not a substitute for medical advice, diagnosis, or individualized therapy. Always consult with your physician, occupational therapist, or healthcare provider before beginning any new exercise program, especially if you have a medical condition such as Parkinson's disease. This video was created by an occupational therapy student under the supervision of a licensed occupational therapist. All exercises have been reviewed and approved for general safety and appropriateness. Use caution when participating. Ensure your chair is stable and have a caregiver or support person nearby if needed. If at any time you feel dizzy, lightheaded, or experience pain, stop immediately and seek medical advice. By choosing to participate, you acknowledge that you are doing so voluntarily and at your own risk. Neither the creators of this video nor the supervising therapist are responsible for any injury or harm that may result. Balance is the body's ability to maintain an upright and steady position. Various systems in the body work together in order to help you balance. These include your proprioceptive system, the musculoskeletal system, and the vestibular system. Proprioception is the ability for the body to sense its position in space. According to Moon et al., the muscles in the body sense positioning of muscles to maintain balance. The musculoskeletal system consists of the muscles and bones in the body. According to Sarbon and Kozing, improvements in strength from resistance training has improved balance. Finally, the vestibular system is a system which covers the orientation and positioning of the head. According to the Cleveland Clinic, the vestibular system provides assistance with proprioception in maintaining balance. There are many benefits to incorporating balance training. From a study by McLaughlin et al. In 2020, balance training has been seen to improve and reduce falls. Dunsky's research in 2019 has also yielded that balance training has improved ADL independence and overall quality of life. Finally, Sparrow et al.'s research has yielded that balance training improves task confidence. While balance training in itself is beneficial, how can we further improve the training to be more task-oriented? The answer is functional training. Functional training involves exercises which utilize specific movements or activities to improve balance and proprioception. It has shown benefits in PD populations with improving walking speed, balance, and cardiovascular endurance. Additionally, with specific tasks, it has shown improvements in mental imagery leading to increased task success. But you may also be wondering, what exercises should I perform? Here are the exercises that I'm going to be recommending. The first are marches and carries, the second are squats and deadlifts, and the third are peel-off presses and halos. Marches and carries are beneficial towards developing core and lower body strength and endurance. The video on the right displays a video of myself performing a kettlebell variation of the marches. While improving balance, they also play a role in promoting your activities of daily life, such as transfers and functional mobility. But what does that mean practically? It means it'll make it easier for you to carry your bags and groceries. The next two exercises we'll be going over are the squats and deadlifts. Similar to the carry, we're improving your core and lower body strength. Strengthening your hips and knees will allow you to pick things off the floor and improve your sitting and standing ability. The middle video demonstrates a barbell back squat, which is more knee dominant in comparison to the video on the right, which is the side view of the deadlift, which is more hip dominant. Finally, we have halos and peel-off presses. Similar to marches, these are core rotation and anti-rotation movements. However, they utilize the upper body for stabilization. These activities help out with feeding activities, such as passing or grabbing food from counters, hygiene, such as brushing your back with a scrub or combing your hair, or dressing, such as putting on or taking off a jacket. The top left video is a demonstration of halos utilizing the kettlebell, while the top right video is using a resistance band in order to perform the peel-off press. Finally, we have halos. According to Escordo et al. In 2021, the optimal training regimen for balance and functional training would be to train at least once a week, recommending working up to training daily, while performing 1 to 2 sets and 4 to 10 repetitions per exercise. While these guidelines are beneficial towards developing a program, there are many ways to grade up or grade down the activities in order to meet your current skill level. The first way is to change the weight. If you feel like an exercise is too easy, slowly incorporate more weight into the exercise. Vice versa, if you believe that you aren't able to complete the 1 to 2 sets of 4 to 10 reps, decreasing the weight will decrease the difficulty, allowing you to perform the activity safely. Second is altering the duration. This can mean two things: changing the time spent performing the exercise or the time spent taking a break in between exercises. This will show improvements in task endurance. Third is tempo. This is how fast or how slow you perform an exercise. According to Gordon et al. In 2024, increased tempo will improve the mind and body connections, leading to improved voluntary muscle activation. And finally is repetition, which is how many times you could complete an exercise. While it's recommended to practice balance training daily, take note of how you're feeling. Start with what you are able to complete and start developing goals towards improving your endurance and your strength. Thank you for watching part 2 of the video series. Check out the description if you'd like to see our playlist for the YOPD series or if you'd like to download any slides or handouts on our Google Drive. See you all next week where we'll be going over exercises for cognition and coordination.